with many hospitals facing a chronic shortage of beds and oxygen. There's also concern that people are rushing to leave the country for the UK before India goes onto the travel red list on Friday. Just to warn you, this report from Davina Gupta contains distressing images from the start.
The final farewell in the holy city of Varanasi, where the last rites of COVID patients are being performed. It is a grim sign of a struggling India, where more than 2,000 deaths were reported in the last 24 hours. With the daily cases reaching nearly 300,000, those who can are trying to leave the country. Many are trying to get to the UK before India is added to the red list of countries. Figures from Public Health England shows 3,300 people travelled to the UK from India between the 25th of March and the 7th of April. Nearly 5% tested positive. This sudden surge has left the already stretched healthcare infrastructure in shambles. In major cities, hospitals are fast running out of beds and oxygen. These people in the central Indian state of Madhya Pradesh, desperate for scarce oxygen, have resorted to looting cylinders to treat their families.
India's capital, where I am, is one of the worst affected cities. In the last 24 hours, 8 major hospitals have asked for support, claiming that they will exhaust their oxygen supply in 6 to 7 hours.
The situation is worse in smaller cities, prompting the country's Prime Minister to appeal to everyone to stay indoors at COVID hotspots, but stopping short of a national lockdown.
We have to save our country from going into a complete lockdown. I urge the state governments to consider lockdowns only as the last option.
But critics have questioned this message coming after a lightning state poll campaign where he addressed mass gatherings recently, despite warnings over social distancing. India is now firmly in the grip of the virus. Many here say more lives could have been saved if the government had acted sooner. Davina Gupta, BBC News, Delhi.